Hello, this is Dr. Context of recent updates related to COVID-19. Uh, there's a lot of context to how novel coronavirus initiated in China and how it turned into an outbreak and then epidemic and then a pandemic. So I'll be touching upon that as well, but I'll be talking in detail about what's happening right now in context to Pakistan and also in context to being a healthcare provider or a healthcare worker who are working at the forefront and seeing all of these patients and managing them. I've been told that most of the audience today are medical and dental students and mainly from fourth year and final year medical and dental background. Okay, so the first section relates to COVID-19 for healthcare providers. So what are the things that a healthcare worker or a healthcare provider needs to know? There's a term that you guys will be hearing a lot during my webinar, and that is the concept of incubation period. So I'll just be explaining it a little bit and then we'll move forward. So I hope you guys are able to see the mouse pointer on my screen. So this is a person who has gotten this infection at this point, and then there is a period till which that person remains asymptomatic and doesn't show any symptom. That person is infected with the virus, with the novel coronavirus, but hasn't shown any symptoms. And then at this point, that person has started showing symptoms. So this period is called incubation period. So you cannot, while a person is asymptomatic, you cannot say that that person hasn't contracted the infection. So this period is very critical going forward. And latent period and period of communicability. Latent period means that that person is not shedding the virus in his or her body excretions till this point, and then just uh, just a week before, just a week or few days before he or she starts showing the symptoms, that person starts shedding the virus in his or her body excretions and also in stools, and that person becomes infective during this period. So this person is infecting other people during this period of communicability. So this was just a basic concept. Okay, so you are a healthcare provider and you're sitting in an outpatient ward or an emergency ward, and a patient comes to you with certain complaints. So how are you going to make sure that that person is a suspected case of novel coronavirus or COVID-19? So that person, those, so there are three definitions to a suspected case. There are three types of cases actually. There is suspected case in which you don't know the exact confirmatory diagnosis to whether that person is infected with COVID-19 or not. So that person is labeled as suspected case. Then there is a probable case. Then there is a confirmed case. So we'll be discussing the suspected case first. There are three definitions, and all these definitions are being rolled out by World Health Organization, and they are being used in Pakistan as well. First is that that person should have symptoms of fever and cough or shortness of breath, any of these. So this is labeled under acute respiratory illness. So fever and cough or shortness of breath. This doesn't include flu or sore throat or other of those common cold or flu symptoms. So just fever and cough or shortness of breath. And then the next question that you're going to ask that person is their history of travel. So right now it's pandemic, so any kind of travel should raise the alarm. So whether that person has traveled from another province, from another city, from another country, any kind of history of travel in the past 14 days, when he or she started showing the symptoms, because that's the incubation period. The incubation period for novel coronavirus is 14 days. So when a person gets infected for next 2 weeks, they don't show any symptoms, and then they start showing symptoms. So during that incubation period, whether they have traveled uh, abroad, whether they are coming from abroad or from another province or from another city, so any kind of history of travel should raise the alarm. And also you have to rule out the other causes as well. So when that person completes this definition, then that person is labeled as a suspected case of COVID-19. Okay, so the other definition is that the person is showing the same symptoms, and uh, uh, also other than the history of travel, that person has shown a confirmed contact with a confirmed or a probable COVID-19 case. Okay, so that person shouldn't be a suspected case, but a confirmed or a probable COVID-19 case, also in the last 14 days. So this is the another definition. And the third definition is that person is so severely ill that you have to hospitalize that patient. So in the endemic area right now, COVID-19 virus is endemic in all of these countries. So that if that person is showing the symptoms of severe pneumonia or ARSD, then you have to assume or presume that that person is infected with COVID-19 virus. So that's the third definition. So if the person is meeting any of these three criteria, that person is labeled as suspected case. And we'll discuss later what to do with a suspected case. What's a confirmed case? You have a suspect, and then you take the sample, you send it to the laboratory, and the laboratory confirms via test that okay, this person has got the virus in the sample, then that person is labeled as a confirmed case. And also I want to emphasize on that person can be asymptomatic and also a confirmed case because of the incubation period. So that person wasn't a suspect, but you did the test anyways during the asymptomatic period, and now the laboratory has sent the results back, and that person has been labeled a confirmed case. What's a probable case? Probable case is that that person was a suspect case. You send the results, but the lab has shown that the results are inconclusive. Lab cannot tell whether it's, they have got their own certain criteria, threshold criteria for labeling somebody as positive or negative. So if they cannot tell for sure, then they'll say it's inconclusive. You're going to you're going to manage that patient as a confirmed case, but labeled as probable case. Okay, so what kind of testing is available out there for COVID-19 virus? I'm gonna discuss that in this section. Okay, first of all, we need to make sure that we are testing only a limited number of people, because if we start testing for mass population, we won't be able to manage it. As of now, Pakistan doesn't have even 100,000 kits available, and we need almost 300, I think 3 million kits. We need 3 million kits, but we have only got 100,000 kits available. So we cannot test mass population. So we have to screen who's going to be tested for COVID-19 virus. So on the top of the list is, these are basically just various forms of suspect case. So a suspect case that we already discussed above, the three definition criteria of suspect case, they are going to be tested anyways. The second point also relates to a person who is almost a suspect case, and also a suspect case who has been found positive for another pathogen. You cannot assume that that person doesn't have COVID-19 virus, because sometimes co-infections are also there. That person has some kind of bacterial infection or viral infection and also can have COVID-19 virus. So all suspect cases are to be tested. Okay, what kind of samples are being taken? I want to share with you guys right now. There are 7 testing centers working in Pakistan. There are some in Karachi, there are some in interior Sindh, there are 2 in Lahore. Services Hospital is one of them. And then there are some in Islamabad and also in Azad Kashmir and Gilgit Baltistan. So when a person enters the public sector hospitals, then their samples are taken and sent to NIH Islamabad, National Institute of Health Islamabad. So that's the only testing facility right now available in Pakistan. But sample collection centers are 7, and maybe they are increasing the number every day as cases are increasing. So what kind of samples are taken? Two kinds of samples are taken. So in patients who are showing just the mild symptoms and are coming in outpatient wards, only the upper respiratory swabs are taken, and then the samples are sent to the laboratory. In patients who have got severe respiratory disease and are hospitalized in ICU or in inpatient wards, their lower respiratory tract samples are also taken via endotracheal aspirator bronchoalveolar lavage. Okay, what type of test is being performed on these samples that the laboratory is able to tell that whether the person is infected with COVID-19 or not? These are called nucleic acid amplification tests. In this test, what they do is they take the sample, so that sample from pharynx of somebody must have virus in it, so must have viral DNA in it as well. So virus, as you know, is protein code and DNA in it. So they target the DNA. So DNA is there in the sample. Then they try to multiply that DNA through PCR. So make lots of copies of that virus, and then it's much enough to be able to detect it. So the technique that is used is PCR, real-time PCR. The difference between simple PCR and real-time PCR is that normal PCR takes a lot of time to be done and then analyzed. Okay, so analysis takes a lot of time, probably 2-3 days. Real-time PCR is that as the multiplication and amplification is being done, it's being analyzed at the same time. And there are 4 steps involved in it. I'll go through those 4 steps quickly for basic science students, first year, second year, and third year medical students. This is the first step of PCR, in which you denature the DNA strands via heating method or other chemical methods. So both strands are separated of viral DNA. and then you add an RNA primer, and in real-time PCR you add a probe as well, real-time probe as well. So on the left-hand side, this is the RNA primer because uh, polymerase enzyme requires the RNA primer to replicate the DNA strand, and probe DNA has another function which I'll tell you guys in the later slides. So DNA polymerase has come, it's duplicating the DNA. As soon as the DNA polymerase hits the uh, probe end, there is a fluorescent molecule at the end of it which gets released, and then the machine is able to detect that molecule through fluorescent. So the more DNA, the more viral DNA in the sample, the more viral DNA is being replicated, the more fluorescent is out there, and the machine is able to detect it. So that's the basic science behind this amplification test. Okay, so you are a healthcare provider sitting on the front desk, seeing and in contact with all of these patients. So you're making the diagnosis, you're taking the samples, sending it to laboratory. What kind of infection prevention and control measures you need to take while you're dealing with COVID-19 virus patients, or even sitting in any busy healthcare facility? Okay, so there are several steps involved in it. The first step is that you have to make sure that when a suspect case walks into a facility, they spend a minimum amount of time in that facility before they are isolated or quarantined. So you have to recognize the case as early as possible, because the more time they're going to spend inside the healthcare facility, the more people they are going to infect, the more healthcare providers they are going to infect. So what are the different steps that we can take to make sure that a case is recognized as early as possible? First of all, the healthcare providers should be briefed about the situation going on. For example, in Lahore, we are already seeing cases reported in Mayo Hospital and other hospitals. So healthcare providers should be briefed that they should be expecting more of these cases coming in the next few days and few weeks. So they need to have a high level of clinical suspicion. When somebody is walking into emergency bay and they're coughing, complaining of shortness of breath, they've got fever, right away they should be diagnosed as a suspicious case of COVID-19. Also, they should be provided with the case definition screening questionnaire so that they are able to successfully define the cases as I already briefed in the initial slides. Because not everybody with cough and fever is infected with COVID-19. There needs to be history of travel or history of contact on the disease has to be severe enough. These are the three definition criterias. So they should have that screening questionnaire. And then also there needs to be signages in public areas of the hospitals where doctors and patients are walking by, so they should be able to see those posters and memorize and rememorize all of these case definitions. So this is how they're able to recognize a case as early as possible. Okay, once you have a once you have a case inside the hospital, what do you need to do about that? So WHO has recommended that all of these symptomatic patients or confirmed cases need to be isolated into separate isolation rooms. So they are not to be put with other patients. So government is building these isolation rooms inside hospitals. You must have heard in the news. Inside these isolation rooms, their beds need to be put at least 1 meter apart. And the second recommendation is that the healthcare workers who are assigned to that isolation room should be the same group working from start till the end. So there needs not to be rotations. For example, a group of healthcare providers coming in the morning, the other group is coming in the evening. That will allow the infection to spread easily inside the hospital. So recommendation is that a group of healthcare providers is assigned for that isolation room from beginning till end. They have followed it in China as well. And also all of these healthcare workers who are working inside this isolation space must use personal protective equipment. And I want all of you guys attention for these next few slides, because I'll be explaining what kind of personal protective equipment for viral infections is present. Okay, so this is a list of personal protective equipment. The healthcare worker needs to wear an N95 grade mask. They need to have eye or facial protection equipment, for example, goggles or a face shield. They also need to wear a gown, which not need to be sterile, because it's going to be infected with bodily secretions, and it's going to be soiled, but there should be a gown. And they should wear gloves as well. Okay, so this is the picture of personal protective equipment. You guys can see the gown here, gloves here, mask here, and goggles here. So this personal protective equipment is enough for COVID-19. Okay, some other contact and droplet precautions. I want to share that there are 4 kinds of isolation precautions that usually healthcare providers need to know and follow inside healthcare facility. First is contact isolation precaution. Second is droplet isolation precaution. Third is aerosol uh, isolation precaution, and fourth is blood or bodily other bodily fluids isolation precautions. So with COVID-19, it's more infective because it spreads through droplets and contact both. Droplet is when somebody is coughing or sneezing, they are putting these droplets out in the air, and if you are in the vicinity, you are within 1 meter vicinity of that person, you're going to, there are more chances that you're going to get infected with COVID-19. Or that person, while coughing or sneezing, has touched um, with his hands his nose or mouth, and then touch another surface, and then virus is able to live there. There are some studies that they tell that virus is able to live there for 24 hours up till few days. So when you touch that surface, you can get the virus on your hands, and then you touch your mouth or eyes or nose, and then contract virus. So it's more infective because its transmission routes are through both contact and droplet. So they have also recommended that in these isolation spaces, you should be using disposable equipment and also dedicated equipment for which is dedicated only for that isolation space. For example, stethoscopes, blood pressure cuffs, and thermometers. There shouldn't be rotation of this equipment as well, and movement of this equipment out of these isolation spaces or into these isolation spaces. And also inside these isolation spaces, when you're going from patient number 1 to patient number 2, you need to clean and disinfect these instruments each time, in order to make sure that, for example, a person who is symptomatic but not yet confirmed case of COVID-19 may not get the virus from a confirmed case who is also in the isolation spaces. Also, the healthcare providers themselves are discouraged from touching their own eyes, nose, or mouth while they're wearing soiled gloves. Also, shouldn't be excessive or unnecessary movement of patients who are residing in the isolation spaces out of those rooms unless it's really necessary. For example, ventilators aren't available inside the isolation spaces and they need ventilators, so they need to be taken out of those spaces. And these patients have got lung disease, so they need frequent x-rays. So a portable machine dedicated for that isolation space is recommended by WHO. Okay, so this section is very interesting. It explains the concepts of quarantine and isolation. You guys must have been hearing these terms lately a lot in the media, because both quarantine and isolation is being done for COVID-19 cases. So I'm going to explain the difference between both of these. Okay, so quarantine, both these terminologies relate to isolating people who are either suspect or confirmed cases. But the only difference between both is that quarantine is an asymptomatic person, but with the history of contact. So that person has not shown the symptoms yet. So asymptomatic person, if that person needs to be isolated from the rest of the society, that would come under the banner of quarantine. And when that person is being quarantined, then that person is monitored closely throughout till that person um, spends 2 weeks, the incubation period of the viral infection, or that person develops symptoms. So then they come under the category of isolation. Isolation is that person is not yet confirmed case of COVID-19, still being tested, but is already showing the symptoms. Okay. So the quarantine and isolation is not based upon anything other than asymptomatic and symptomatic. So if the person is asymptomatic, he or she goes for quarantine. That person is symptomatic, then they go for isolation. Okay, where are we doing the quarantine and where are we doing the isolations? Quarantines are being done in it can be done in any facility which can host all of these uh, asymptomatic cases but with the history of contact. So China has done it in hotels, dorms, other facilities, and also people are being advised now in Europe and in US to do what we call home quarantine. That if you are not showing the symptoms, but you think that you have been in contact with a person who is now a confirmed case of COVID-19, then you should self quarantine yourself. Okay, for how much period you should be quarantined? It's 14 days when you came into contact with a confirmed COVID-19 case. So you wait for 14 days, because within 14 days you are going to, if you are infected, you are going to show symptoms. If you're not infected, you'll be fine. So quarantine is being done at airports, at provincial ports of entries, for 14 days. In Pakistan, they are not doing home quarantines. In other places, they have set up quarantine camps at the entrance of provinces and also at the entrance of Iran border and 3 international airports. So they are putting these people in those quarantine centers or camps. Okay, so who should be, again, we talked about that the person who is asymptomatic and has come in contact with the confirmed COVID-19 case. So how do we measure the contact? So there are three definitions to it. First definition is that you are a healthcare provider and you weren't wearing any personal protective equipment while dealing with a confirmed COVID-19 case. You did not know at that time that that person is COVID-19, but later on that person turned out to be a COVID-19 confirmed case and you were dealing with that person without any personal protective equipment, then you are to be quarantined because you're not showing any symptoms, but you have come in contact with a confirmed COVID-19 case. Second definition is that you have stayed in a close environment with that person who later turned out to be a confirmed COVID-19 case. And that same close environment is within 1 millimeter space. Also, if you have traveled with that person within the proximity of 1 meter, then you are to be quarantined as well. Okay, what should be done if you are choosing home quarantine over other quarantine methods? Then you need to have a separate single room. Well ventilated means that it should have cross ventilation. Also, you should keep a distance of at least 1 meter from other members of the household, and you should have separate toilet and also separate utensils for eating to avoid contact transmission as well. Okay, so we discussed the quarantine and isolation. About isolation, so quarantine is being done in hotels, in dorms, in camps. Also now Europe and US, they are resorting to home quarantine. What about isolation? So isolation is mainly being done inside a hospital. So hospitals, when you're showing symptoms and the hospital has yet to confirm your diagnosis, you're a suspect case who's showing symptoms, then they put you into these isolation spaces inside hospitals, and then they wait for 2 weeks, um, or your laboratory result. They wait for your laboratory result. If it's negative, then they let you go, manage you, let you go. If you are a confirmed case of COVID-19, then they make you stay there till you recover. So quarantine is being done in all of these other places, and isolation is being done in hospitals, including Pakistan. Okay, when you have a suspect or a confirmed COVID-19 case who is showing symptoms, I mean, who's sick, who's ill, how are you going to manage it? I'll quickly go through these slides. So these are different spectrums of illnesses that a person with COVID-19 can have. Uh, they can have mild illness, they can have pneumonia, they can have severe pneumonia, they can have what we call acute respiratory distress syndrome, they can have sepsis, they can have septic shock and die because of septic shock. Most of these patients, and mostly belonging to the adult age group, have mild illnesses. So they fall into this category. Some studies are showing that 90% of the total cases are falling in mild illness criteria. But they also get they are also being hospitalized as well. So it doesn't mean that we should take it lightly. And then some of the percentage of cases are falling into severe pneumonia and and that's where most of the mortality are happening. What do you do with this? You isolate inside hospitals. Some countries are also what happened? Okay, sorry for this glitch. Okay, the next category is severe pneumonia. That's when their symptoms are not being managed in simple isolation rooms or at home. That's where you properly hospitalize them and start their care. First thing that you do is you admit them. Second thing you do is you start them on supplemental oxygen therapy, and your target should be 94% oxygen saturation. And this is measured with a pulse oximeter. So all of these health care providers and patients should have access to pulse oximeters as well. And you do regular monitoring of their vital signs that include their breathing rate as well, and their heart rate, their blood pressure. And also you send all of the baseline lab testing as well, which include kidney function test, liver function test, and other baseline blood tests. Okay, so the next thing on spectrum is acute respiratory distress syndrome, and this is where I already told that this is where most of the deaths are occurring, and also above the age of 60. Mostly in these patients, there are superimposed bacterial lung infections. So you give uh, what we call empiric antimicrobials to all of these patients within 1 hour of initiating the treatment. Then you intubate them and start the mechanical ventilation. Mechanical ventilation means that their lungs are not working enough to provide them with enough oxygenation. So you make their lungs work from outside. So you make the lungs expand, expire, and inspire with the outside support. So that's called mechanical ventilation. And also there is something which also comes under the spectrum of mechanical ventilation, positive and expiratory pressure to keep their lungs expanded. And then the extreme is extracorporeal membrane oxygenation, in which an outside machine is used as lungs. So all of the blood is passed through that machine to oxygenate it. So that's the extreme level. And right now, we don't have, I mean, we are acutely short of mechanical ventilators. If we were to receive a large number of cases inside Pakistan, we won't be able to handle them. So prevention is the key. Okay, how should the community respond to COVID-19? They have already rolled out these public health measures, but we need to make sure that we memorize them and we tell our healthcare providers and workers and tell our families and friends that they should be adopting all of these measures. First is hand hygiene. In hand hygiene, we expect people to either wash their hands with soap or rub their hands with alcohol based hand sanitizers after doing any activity that needs washing their hands. That includes uh, touching their nose, mouth, um, face, using toilet, after using toilet, before eating food. So all of the normal hand hygiene measures. Also respiratory etiquettes that WHO doesn't recommend that you cover your face with hand while you're coughing or sneezing. They either recommend that you use a tissue paper or you use your bent elbow. And whenever you cough or sneeze, you make sure you sanitize or wash your hands anyways, especially in these circumstances. And if you have any kind of flu, cough, you should be using masks to avoid spreading this infection to others. And also when you are in the vicinity of somebody who is showing flu, cough, or shortness of breath, you should be wearing masks. And a normal medical or surgical grade mask is enough. You don't need to wear N95 mask for that. And you also don't need to wear mask all the time, only when you are showing the symptoms or you are in the vicinity of somebody who is showing the symptoms, including while you are inside a healthcare facility as a medical or dental student or a healthcare provider. And community also has to be involved in identifying patients who are sick and quarantine them and isolate them and make sure that they are receiving the proper care. So cases uh, shouldn't, uh, I mean, we shouldn't be hiding the cases. So that's also the responsibility of the community. Also, we have to follow the travel advisory and all of the other advisories. Recently, government of Pakistan has announced vacations for students um, and close their educational institutes. Now, what they are doing is that they are doing is they are partying outside in shopping malls and going to cinemas. So this is not the reason that an emergency has been declared. It's being declared that you stay inside your homes. There is a concept of social distancing. You must have been seeing a graph on the social media that how cases, once the local transmission starts, how the cases double each day. The only factor that has shown to flatten that graph is social distancing. That you stay inside your homes, you avoid unnecessary outdoor activities, and you stay away from other people at least 1 meter apart. So we have to follow all of these advisories rolled out by the government or WHO, and also keep our environment clean, including the hospitals. And hospitals should adopt to cleaning their floors and surfaces with disinfectants. Okay, the other public health measures that can be taken are that you have to avoid crowding, including weddings, events, and this is the reason we have postponed our event as well, and all of the other events have been cancelled as well. Recently, CDC has issued an advisory for USA that not more than 50 people should gather at one place at one time. Also, schools are being closed in Pakistan. They have already been closed in some cities, metropoles, and they've closed the public transportation as well. Companies are closing their offices, especially in United States. And also, the community has to come forward with the quarantine and isolation measures. So far we have discussed we discussed how you're going to diagnose a case of COVID-19 when you are sitting in an outpatient ward or an emergency healthcare facility. How are you going to test that person? How are you going to make sure that you are safe while you are taking care of that patient? And also, I explained the concept of quarantine and isolation. So next time you hear these terms on media, you'll know right away that people who are being isolated are symptomatic and waiting for the confirmation of their diagnosis. People who are being quarantined are asymptomatic and uh, with a history of contact, and they're just going through 2 weeks period before they're being released back into the society. And then we discussed, once you have a asymptomatic, ill, sick, suspected or confirmed COVID-19 case in isolation space or inside your ICU, how is that patient going to be managed? We quickly went through that. And then how should community overall respond to this COVID-19 phenomena, and in which the responsibility of medical and dental students is that they need to be aware of all of these concepts. And this is why we did today's webinar. And then you spread this message to community and healthcare providers and workers. So your message should be towards your families and friends is that avoid going outside unnecessarily, stay inside your homes, avoid unnecessary contacts, stay at least 1 meter away from other people. So this is social distancing is the message for community and for healthcare providers, your and for yourself as well. Your message should be to make sure that you have personal protective equipment with you while you're dealing with COVID-19 cases, or while you are doing any duty inside healthcare facilities, because you can expect a COVID-19 case in any scenario, in any ward. Okay, then I'll share the daily situation report of Pakistan. This is of March 15th, because they have not yet published. They publish at the end of the day. So for March 16th is yet to come. Yesterday we had 53 confirmed cases, but today we have almost 100 confirmed cases. So it means we are on that pathway of daily doubling of cases, and it shows that local transmission is already happening. So before, these patients were coming from outside of our country and they were bringing this virus from outside. But local transmission means that now people are getting infections from people who have traveled from outside into Pakistan, and now local transmission is happening. And this should raise the alarm. Now in 1 day the cases have almost doubled. Okay, first, as you guys know that novel coronavirus, it's from a family of coronavirus. The other virus that we read a lot is common cold, which causes common cold. Influenza is another family. So one of the other virus that we already read a lot about is common cold virus. This is also from that coronavirus family, novel coronavirus. So it it started in the city of Wuhan in Hubei province in November 2019 in a fresh meat market. So these coronaviruses mostly they reside in mammals, and then there is a thing called species conversion that happens, that they are in mammals and then they come in contact with humans, and then the virus infects a single human, then it starts spreading. So in China, that species conversion happened in November 2019, and then we saw a surge of cases in Wuhan city, and then it spread all across mainland China, and then soon it became an international public health emergency declared by WHO, and then it got converted into a pandemic when it almost reached all of the countries of the world. Right now, this slide must be showing. Right now, it's in 142 countries. Total 1,65,000 cases, confirmed cases, and total deaths are close to 6,500. And then it got spread to Iran, and Iran was late in responding. So too many cases in Iran and deaths as well. Then Europe now has become the epicenter of the pandemic. This is declared by WHO. It has spread to US already. US is also responding to it. But what about Pakistan? Pakistan by now is not fully prepared to counter this if God forbid lots of cases were to happen in Pakistan. We don't have enough ventilators available, we don't have enough kits available. So the only thing that we have available is God and then prevention measures sent by Him. So we have to resort to prevention. And this is my take home message for the webinar today. I'll be opening the question answer session now. Aisha, can you open your mic and moderate the rest of the session?
Assalamu alaikum everybody. My name is Aisha Rehan and I'm the president of the National Council for 2020. This winds up the session with Dr. Umair. Now we're ready for any questions that we might have. Do we have any questions? Okay, so what we'll do is I'll say the name of the local council, and if anyone from that local council has any questions, you can unmute your mic and you can ask that question. So first of all,
Aisha, can I go first?
Sure. Sorry, who are you speaking?
Hello, everyone. Thank you, Aisha and Umair, for this elaborate webinar.
Okay.
So my question would be, in case of mild cases, what would be the time span of the illness, and how will the illness progress with regard to symptoms?
Okay, can you hear me now?
Yes.
Okay, so in regard to mild illnesses, the recovery period is also 2 weeks, and almost 90% of the cases do not convert into a severe disease and they get resolved within 2 weeks. And only about 10% of the cases go on to proceed to severe pneumonia.
Okay, thank you. My next question is, there are predictions that this surge is going to die down and it's going to reappear after 10 years, and then it will die for good. So how authentic is that, and what are your remarks on it?
Okay, can you hear me now?
Yes.
I think okay. So yeah, the pattern that we have been seeing in past 1 century is that after every 10 years, one of such epidemic, a global scale epidemic or a pandemic coming in that. And but this is not a pattern that is scientifically proven. It's just by accident that it's happening and by human mistakes. For example, in case of China, we had SARS, and then we COVID-19. It's because of the cross contamination of fresh that happens in the fresh meat markets. That's where the CPC conversion happens. So China has been told by the other countries of the world to ban the mixed fresh meat markets where all kind of is put together, and it uh, it promotes the CPC conversion of these coronaviruses. But there is no scientifically proven pattern that after every 10 years this pandemic has to happen.
And can I add something over here?
Yes.
So basically, as we all saw that it started in China in December 2019, right? So 5 days ago, 4 to 5 days ago, China has closed all its public health facilities. The temporary public health facilities it started. So we can already see a decline in China. And this all happened in a period of 2 months, 2 to 3 months. So hopefully around the world also this pattern will prevail, and in 1 or 2 months we will see a decline in these cases. Okay. Dr.
Okay,
Ekman, do you have any other
thank you. That will be
But
all.
I also I want to add on top.
Yes, Dr. Mayor?
Okay, I want to add on top of that that this is not a thing that is going to go die down on its own. China did a lot to make sure that that happened. I mean,
Exactly.
they closed their entire cities. They implemented these quarantine and isolation protocols. They make sure that their healthcare providers were wearing personal protective equipments. And they had the best surveillance and response measures in place, and that's why we are seeing a decline in the number of cases. The same strategy was implemented in South Korea and Japan. With Italy, what we have seen is the worst of all. I mean, China is not the worst example. Italy is the worst example because they took it very lightly in start, and they delayed the closures of their entry ports and these quarantine and isolation practices, and also their healthcare facilities got stuffed with these mild illness and severe illness the mortality rate in Italy, the global mortality rate is 0.2%, like 2 people out of 1,000 patients are dying because of. But in Italy, the mortality rate is 0.2%.
Dr. Mayor, we can't hear you.
Out of each 100 cases, 7 people are dying. This is because of overcrowding of the facilities
Hello?
and not the infection itself. So if not known, is decline. As far as Pakistan, we are going to see a rise in case. Lahore and some are from Karachi. I mean, Sindh government is
Dr. Mayor, we can't hear you.
doing a lot better.
Hi, everyone. I request all of you to please wait. Dr. Mayor is trying to reconnect his laptop.
Okay, am I connected again now?
Yes, you're connected. Can you repeat the last few sentences that you said, because we couldn't hear you properly?
Okay, so I was saying that we'll have to implement the strict social distancing measures, staying away.
खराब हो गया. Dr. Mayor, we cannot hear you. Okay, those of you who are
People outside at least 1 meter apart.
Okay, guys, you can send in your questions in the group chat and I'll read them out. Because the internet connection is unstable.
No, I think.
Dr. May, there's a few questions that people have, but the laptop keeps on losing connection. So, like, let's all just.
No, I I think now the internet connection is stable.
Okay. Okay, so we have a
Yeah.
question from Isma Binti Ashraf. Isma, you can turn off your mic and you can ask the question.
Hey, can I ask a question?
Yeah, sure.
Yeah.
Can you please tell us where you're from?
I'm from Fatima Memorial and my name is Namira. So I have one question.
Okay.
Okay, so basically what I have to ask is, I get that it's a very dangerous disease, but the death rate is relatively very low. So why is like everyone super scared, and why do we have to put people on quarantine? Like, this is not the only infectious disease we have. So why do this for corona?
No, there is a difference between mortality and hospitalization. So if we are just looking at the mortality numbers, that's not going to give us the real picture. If people are getting sick and even to the point of severe disease, let's say there are like 10,000 severe cases of coronavirus in Pakistan, our hospital system cannot cater for them. I mean, we are going to be stuck with all of these patients, and then we won't be able to implement the cross contamination protocols inside the hospitals, and a lot of normal patients are going to get infected. So if you look at the data of hospitalization, 30% of the hospitalization rate is 30%. That's a lot. So mortality rate is 0.2%, like out of 1,000 patients, only 2 patients are dying. But if we look at the hello.
Hello? Your voice keeps getting stuck. Should I move on to the next question?
Hello, can I ask a question?
Yes, sure. Please tell us your name and where you're from.
I'm Mahmood Abbas and I'm from the Shifa Medical College, Islamabad.
Okay.
And I have a few questions from sir. The first question would be, as we are hearing from a lot of people that the coronavirus would die off as the temperature would change, as we are on the brink of ending of the winter season and the summer is approaching. Can we expect a drop in cases as the temperature changes? The second question that I'd like to raise over here is, are there any other carriers for the virus? Because many people over here have certain pets at their homes. Should they be scared of the carriers? And the third question, with the coronavirus, we have seen that mostly the people which is had affected has been people with a immune response compromised, mostly who are diabetic or mostly who are in their elder age. So, are there any specific preventive measures or protocols for them? Thank you.
Okay, so I couldn't hear your first question. Can you repeat it, please? You had three questions, right?
Yeah, my first question is, as we have been hearing that the coronavirus would die off if we have an increase in the temperature. So we are on the brink of the ending of the winter season and the summer is about to start. So can we expect a greater, good news that we have a change in the weather? So should we expect a decrease in the cases of coronavirus?
No, we can hope for that, but we shouldn't be expecting that because in Australia, where there is a hot climate right now, the cases are spreading at the same rate as they are spreading in Europe or colder climate areas. So there is no scientific evidence so far that the temperature is going to affect this pandemic. We can certainly hope for it. And your question was, mortality is more in people who have diabetes, COPD, and already have immunocompromised states. But as far as the hospitalization is concerned, even healthy individuals with who were immunocompetent have ended up in hospitals and stayed there for for like 1 week or 2 weeks with severe disease. So young people should also be, should also see this as a danger and not take it lightly.
Okay,
And
so
as far
Dr.
as the healthcare providers group got have got infected and have died, they were mostly in the adult age group. So in China, most of the deaths of healthcare providers happened between 30 to 40 age year group. So all of you, all of the participants, I mean, everybody needs to take this seriously.
Okay, so Dr. Ahmed, a lot of
Most
people have this question that how is this virus related to temperature, and how can temperature affect its transmission? And if this virus isn't heat resistant, so how can we expect that when temperatures will rise, this virus will be eradicated or killed off? So can you emphasize a little bit again on the temperature relation of the virus?
I skipped one question. The question was for the other routes of transmission. No, the current strain of novel coronavirus is only human to human, and we have not seen it being transmitted through any other species. Okay, your question, I think, Aisha, your question is similar to what was already asked. The
Exactly, a lot of
relationship with
people.
the temperature. There is no there is no relationship with the temperature as such, because in Australia right now, where there is very hot climate right now, transmission happening as fast as it's happening in colder climate areas, and there is no reduction in the pace of virus growth in areas where there was winter, and now spring it's spreading as fast as was doing during winter. So no relationship with temperature, and WHO has strictly refused to accept this as a scientific evidence. They have categorically said that there is no relationship with the temperature, and we
Okay,
shouldn't be
so Ahmed
putting a lot of
Salman.
expectations from.
Ahmed Salman from Rawalpindi Medical University has two questions. Ahmed, you can turn on your mic and ask these questions. Hello?
Hello, can you hear me?
Yes, we can.
So my question was about the rumors of the news that about 14% of the patients who had been earlier cleared from the hospitals in China are returning with the disease. So can this disease occur again after being treated? And the other question is is WHO recommending a antiviral regime for the treatment?
Okay, about the reinfection rate, yes, we have seen cases, but it's not as high as it's being reported. Like, it's certainly not 40%. China is very like a conservative regime, and they have not uh, shown all of the data to the world or to the WHO. So we cannot say for sure, but it's not. It's a very small number. And again, in age group, in immunocompromised age group, who were above 60 years of age and had lots of comorbid conditions. And
Okay.
your other question was?
And what about the antiviral regime? Is there a recommended regime of antiviral drugs for this disease?
So far, I mean, China has already approved a drug uh, for COVID-19, but and lots of other laboratories are also testing. But so far, WHO has not recommended or approved any drug for it. They have approved a combination of. They have not approved. They have suggested a combination of chloroquine and an antiviral medication in severe, but so far it has not shown uh, evidence to the point that they approve a drug, because usually FDA in United States approves a drug and that's seen as an international benchmark. But so far, no antiviral regime has come out specifically for COVID-19. I mean, hospitals are trying on their own, trying different combinations.
Okay. Hurmat Fatma Azim has another question. Hurmat, you can turn on your mic. She's from Rawalpindi Medical University.
Assalamu alaikum. I'm Hurmat from Rawalpindi Medical University. So, can you hear me?
Yes, yes.
So my question was basically, as medical students, what can we do? Like you already mentioned the community measures that need to be taken and everything, and what we can convey to the community and our friends. But since the health system right now in Pakistan is very overburdened right now, right? So what can is it really wise for medical students to like volunteer or to want to contribute in some way to the the burden that is going on, to like try to relieve that burden?
No, no. I mean, WHO has not recommended it, and also I wouldn't recommend it as well. Right now, the recommendation is just stay at home because all of you have been given vacations for a particular reason. That reason is that you stay inside your homes and you also tell your families to stay inside home unless you have to go for necessary uh, grocery from a small shop or uh, go to a pharmacy to get necessary supplies. But other than that, the recommendation is to just avoid social distancing as much as possible. They have recommended that volunteers should come for the quarantine places, but that recommendation has not made its way to Pakistan. So I cannot. In USA, they have recommended that people should volunteer for quarantine places only, where they have got asymptomatic patients waiting for 2 weeks, only to be then released back into the society. But for Pakistan, I would certainly not recommend it. Here, actual healthcare providers are already protesting because they are not being given adequate personal protection equipment. Inside hospital, they are refusing to take care of COVID-19 patients. So at the same time, for medical students to jump in without any facilities and contract this illness, it's not recommended.
Okay. Larif Arsh, you
Right,
can go
thank you, sir.
next. Larif Arsh.
Assalamu alaikum.
Assalam.
My name is Lariba. I'm from Rawalpindi Medical University. My question is that some people do keep pets with them and play with them every time and wash their litter. And so, what special precautionary measures should they practice?
Then how should they deal with the pets? Was that the question?
Yes, yes, yes.
No, it has got nothing to do with the pets. The transmission is only from human to human, so there is no problem dealing with your pets. You
Okay,
can just.
thank you.
Larif had another question.
My second question is why it is advised not to eat or meat containing foods and fast foods like pizza and all that.
No, these are just rumors. There is no problem in eating meat. It's
Okay.
it's advised that you cook it enough to avoid other infections, but not for COVID-19. You can just continue your normal diet.
Okay, thank you, thank you.
Okay. The next question is from Faiza from Rawalpindi Medical University.
Assalamu alaikum. Hello.
Yes, we can hear you, Faiza.
Okay. My question is that um, are allergies, for instance, the ones that result in runny nose and stuff, like for instance, pollen allergies, or people who are already or are very susceptible to getting allergies, do they make a person more susceptible to getting severe symptoms, for instance, ARDS, if they get infected by the virus?
Yes, they are in a high risk group and they need to make sure that they are taking extra precaution related to COVID-19. Uh, so they are in the high risk pool.
Okay.
Hello.
Thank you.
Okay. Hajra, you're next. Hajra, please tell us where you're from.
Hello.
Hello, yes, we can hear you.
Okay, I'm Isma from King Edward Medical University. My question is that if someone has cough but no fever or shortness of breath, then we label it as a susceptible case or not?
Again, we'll have to, Isma, thank you for asking this question. Again, we'll have to resort back to the suspect case definition, whether there was a travel history, whether there was a proven contact with a confirmed case. So if both of these are not there, then you need not to worry. I mean, you can, it could be simple other common cold or some other viral infection. So
Okay, thank
history
you.
of contact with a confirmed COVID-19 case or a history of travel from other city, province, or country in past 14 days is a mandatory criteria for a suspect case.
Okay,
Okay.
thank you. Next, we have a question from Hajra, who is from Fatma Jinnah Medical University. And Hajra has asked that, as we know that only dry cough and fever are initial symptoms, so how can we diagnose a person as a patient of COVID, knowing the fact that the test for COVID in labs is so expensive, we cannot suggest this test to everyone having a sore throat and cough?
Okay, again, we have to resort back to the case definition. If that person is fulfilling any of the three case definitions, first is that you have these mild symptoms with the history of travel, mild symptoms with the history of contact, or very severe disease. You're not going to suspect that case as a COVID-19, and you don't need to test it as well. And also, once you have a suspect case, then you may need not to resort to these private labs because they are doing the wrong kinds of tests. They are doing the blood tests, which are not recommended at all. The only laboratory inside Pakistan doing standard tests is NIH Islamabad, and there are designated collection centers all over Pakistan where you go and your sample is taken and sent to Islamabad and you wait. You spend some time in the isolation in hospital and then they wait for the results to come back in 2 days, and 1 day or 2 days, and then you are designated as a negative case or a confirmed case. So going to these private labs is not recommended at all. I know they're charging 6,000, 7,000 rupees from everybody. It's just part of the frenzy. We should not go for the frenzy. And again, being health, being medical and dental students, you guys need to go back to the case definition. If that person is fulfilling the criteria, then you proceed with the quarantine, isolation, or testing.
Okay, thank you, Dr. Umair. The next question is from Sayyida Ayman Haider from Shifa College of Medicine. Hello, Ayman, can you hear us? Okay, so Sayyida Ayman Haider has asked that she wants to know about the vaccine for coronavirus. Can you shed some light on that?
I mean, companies all over the world, especially in United States, are trying to come up with a vaccine. But usually the time period that's required to come up with a vaccine is at least 1 to 2 years. Uh, So it's going to be very difficult, but they are really trying to do that in the minimum amount of time possible. Previously, United States was resorting to making a vaccine, but now they have changed their shift to social distancing and quarantine as well. So the maximum focus of all of the countries facing this challenge is right now shutting down the usual uh, happenings of the society, and that's what Pakistani government has done as well at the right time, that they have closed all of these colleges, public places, gatherings, events.
Okay. The next question is from Shahid Ali from Qaeda Azam University. Shahid, you can turn on your mic and ask. Hello, Shahid. Okay. So, Shahid, I'll ask you a question on your behalf. Shahid wants to know about the pathogenesis of coronavirus infection.
Pathogenesis of coronavirus
Yes,
infection.
pathogenesis of coronavirus infection.
It's the same with all of the other viruses. They've got lysogenic cycle and lytic cycle. So once you contract this virus, it goes to your epithelial cells of your pharynx and larynx, and then it resides in there and it mixes up with the DNA of your own epithelial cells. It stays there for a while, and then during that while it makes its copies. And when there are so many viruses inside a single cell that it cannot cater for any more of the copies of cell, then the cycle goes into lytic phase and the cell just bursts, and all of these viruses, I mean the cell dies. Okay, there is inflammation around that area, a lot of white blood cells come in, the vasodilation also happens, so lots of fluid is also in the airway, which causes cough. So virus is out there, lots of fluid is out there, and when somebody coughs, that virus along with the fluid and mucus comes out and infects the other people.
Okay. Thank you, Dr. Meher. The next question is from Sharyar Mughal from Shafa College of Medicine. Shreya, you can turn on your mic and ask the question.
Assalamu alaikum.
Alaikum assalam.
My question was that as we know that this surgical mask and all that, are they effective in these measures? And my second question is that as we know that most of the sanitizers are antibacterial, and the COVID is virus. Is it effective in that case?
Yes, alcohol-based hand sanitizer are effective in preventing the cross infection of COVID-19. So hand sanitizer has to be based on alcohol. So you can, I mean, you can check it within the ingredients that if alcohol is part of it, then you can be comfortable with using it. And what was the other question?
My other question was about the precautionary instruments, or we can say that is general surgical mask is effective in case
The
or
size,
every healthy person is need to use
the
that
size,
mask or not?
yes, the size of COVID-19 is a large virus. Okay, it's more than 400 microns, so it's larger than the pores of surgical mask. So surgical mask is enough for community settings. But once you are inside hospital dealing with COVID-19 patients, then you have to wear N95 grade mask, because you're doing lots of stuff with their throat. You're intubating them, you're putting them on ventilation. So during that, N95 grade mask is recommended. So if you're at at a place where you are expected to see COVID-19 suspected case, then you should wear N95 grade mask. But if you are outside in society and you have symptoms, you are around people who have symptoms, then you can just wear simple surgical mask.
Okay. Thank you, Dr. May. Thank you, Shreya, for asking this question. The next question is from Fiza Tahir from Fatma Jana Medical University. She's asking that if the use of vitamin C really helps our immune system protect us against this virus, or is it just a myth?
I am not aware of the particular study, but this virus doesn't really do much with the immunocompetent age group, adult age group. So our immune systems are already uh, enough to fight this. I mean, there is a period of illness, and maybe you need to be hospitalized as well. But eventually, your immune system is able to overcome that. Only in people who are above the age of 60 and have comorbid conditions are prone to this, and I'm not really aware of the scientific evidence that what does vitamin C do in that age group.
Okay. Arfa from Allama Iqbal Medical College has the next question. Arfa, you can unmute your mic and ask this question.
Can you hear me?
Yes, we can. Arfa, we could hear you, but now we cannot.
I think she is.
Can you hear me now?
Yes, we can.
Okay, so my question is that as medical students, we were visiting the hospital regularly until 2 days ago, and also those patients who visit the hospital regularly, they might have come in contact with an infected person in the OPD, for example, and later on, if any patient who has been visiting hospital or any medical student, for example, develops sore throat, dry cough and fever, so should they get tested, and if not, how long should they wait for? And my second question is that I have been reading online a lot that sore throat is the first symptom to appear. And as Dr. Umair mentioned, a suspected case, they have not written a sore throat as one of the main symptoms. So is it a symptom or not? Thank you.
Okay, thank you for asking this question. May I know in which city, I mean, from which city you're from?
Lahore.
Lahore. Okay. As far as Lahore is concerned, the first reported case came just about yesterday. So you guys need not to be worried about visiting hospital in past 1 week. And also, you're from Allama Iqbal Medical College, right?
Yes.
So there have been no reported case or even suspected case in Jinnah Hospital. So you guys need not to be worried about that. What was your other question? Yes.
No, but what about the other, for example, students of KE or any other, if people are visiting other hospitals where there are cases?
For Karachi especially, I don't know for how long they've been given vacations, but if they were visiting hospitals at the same time when there were suspected cases inside those hospitals, if they were to develop cough or shortness of breath or fever, they should immediately report to the healthcare facility or call on their helpline. So students from Karachi, I mean, it's highly recommended that if they go on to develop such a symptom, they should immediately report that. And as far as students from King Edward Medical University are concerned, I think they were given vacations before the first case was reported to the Mayo Hospital, so they also need not to be worried about this. But healthcare providers right now working in Mayo Hospital, if they were to develop symptoms, they should immediately seek help and also report themselves as suspected cases.
Okay.
COVID.
And my second question is that is sore throat an important main symptom? Because you didn't mention it, but I've been reading a lot online that sore throat is the first symptom that develops in coronavirus.
Sore throat coupled with flu is not a symptom for COVID-19, but sore throat coupled with cough can be a symptom leading towards the COVID-19. So it
Okay.
needs to be aligned with the other symptoms. So if there is flu, then it's common cold, and if it's cough and sore throat, then it can come under the COVID-19.
All right. Thank you.
Thank you, Arfa. Next, we have Navera from FMH. Navera Khalid from FMH.
Hey, my question was the same. Can we use sanitizer against the virus because sanitizers are antibacterial? तो वो आपने answer कर दिया.
ठीक हो गया. Thank you, Navera. Okay. The next question is from Hafsa. Hafsa, please tell us where you're from. ये भी वैसे आंसर हो गया है regarding mammals and why we should avoid eating meat, or like is it just a myth? So this has been answered. We'll move on to the next question from Arbaz Klasra from Rawalpindi Medical University. I hope I'm pronouncing the name correct. You can ask the question. Arbaz or Arbaz, I'm sorry, I don't know how to pronounce your name. From Rawalpindi Medical University. Okay, so I'll ask the question on his behalf. He has asked that what is the role of asymptomatic transmission of this virus and how can we stop this transmission? I think this has been answered in the slideshow. He has also asked that.
Sir, I can repeat the answer that the infectivity is equally important during the incubation period as well, because probably by the incubation period is 14 days, but the infectivity starts after the first week. Okay.
Okay, he has also
So
asked
while
that
you are
when is the patient most contagious?
when is the patient most contagious? It's right. It's right where you develop symptoms as well. That's where. So when your infectivity period begins probably 4 to 5 weeks before the symptom starts, but right when you develop symptoms, that's where the infectivity, that's where you're shedding most of your viruses. So probably right when you begin your symptoms, that's where the infectivity is next.
Okay, so the next question is from Sumbul from Rawalpindi Medical University. Sumbul Ibrahim, you can turn on your mic now.
Assalamu alaikum.
Alaikum assalam.
I'm Sumpal. I have two questions. So my first question is, we've been reading a lot about the recommended diets and stuff on internet. So is there actually some authentic recommended diet for the prevention of this disease? And then my second question is that we've been talking about is the prevention of the disease. So if someone gets the disease and is in stage of mild symptoms or has not reached the hospital yet, so is there some way he can do something about his disease so that there's better prognosis?
Dr. Mayor, can you hear us? Dr. Mayor, can you hear us? Yes, please bear with us for a few minutes. There's some issues going on with Dr. Mayer's mic. Okay. So, Dr. Mayer, so we have Sumbal Ibrahim with us from Rawalpindi Medical University, and she's asked 2 questions about the diet that is recommended for the prevention of COVID-19. And her second question is that if a person is already diagnosed with yes. Okay, so no, okay, you can answer her first question and then we can move on to the second question.
Okay, the first question was about the diet. There is no recommended diet as such for the prevention of COVID-19 because the mode of transmissions are through droplet and contact only. And so for the healthy age group, there is no recommended diet. The only recommendations are that you socially distance yourself and you limit your outdoor activity. As far as the age group beyond 60 and with immunocompromised state, they have got their own specific individualized diet recommendations. So I cannot give one single recommended diet.
Okay. So her next question is that if a person is already diagnosed with COVID-19, is there something they can do to have a better prognosis for the time being?
Yeah, so they are the management for COVID-19 is according to the symptoms that they are showing. If it's a milder infection, then they are managed supportively, which includes giving them antipyretics for their fever, isolating them, and also uh, giving them a standard diet. And eventually, within 1 to 2 weeks, their own immune system is able to overcome the viral infections. So they just have to report themselves, isolate themselves, and be under the care of treatment team. And also, treatment team directly or indirectly monitors the follow up of the symptoms as well. The symptoms are getting better or symptoms are getting worse. So based upon that, they change their treatment plan as well.
Thank you, Dr. May.
Like for the time being, if they do not have a treatment team or someone and they do not have all those facilities, so how can they cope with it?
If they have a milder infection, then they can just isolate themselves within home and take, for example, if they have fever, they can take um, antipyretics. If they have cough, they can take medication for that as well. And also they can take lots of fluids if they are in the healthy age group. If they are beyond 60 years of age, then lots of fluid is not recommended. But if they are in the adult age group, then they are also recommended to take lots of fluid as well, because viral infection gets you low on the hydration.
Okay, thank you.
Okay, thank you, Sumbal. The next question we have from Adila on the lead. Adila is from AIMC, I think. Adila, you can turn on your mic.
Assalamualaikum, can you hear me?
Yes, we can.
Okay, my question is that there's been a message circulating online that you should not not be taking aspirin, ibuprofen, naproxen, and Ponston for the fever, and only paracetamol is to be taken. Is that authentic?
Mm, I mean, generally we recommend in the beginning that the patients take only Panadol slash paracetamol, for the reason because if we give them NSAIDs, especially in the age group of beyond 60, then they may develop some stomach problems because it tends to cause the stomach ulceration. These NSAIDs, if they are taken over the period of 1 week. So generally, we recommend taking paracetamol only, but this whole message seems to be a fake one. So
Also, Adila, I don't know about Leproxen and Ponston, but about aspirin and ibuprofen, it's contraindicated in viral infections because it causes Reye syndrome in children under the age of, I think, 6. It causes encephalopathy and liver failure and similar symptoms. So that's why I think they've correlated that with other viral infections.
yeah, for children, I mean, these recommendations have got nothing to do with COVID-19. These are
General, yeah,
separate
general viral.
recommendations that children not take aspirin.
Okay.
And then there is another message that patients of blood pressure should only be taking a melodiphen and not Wilcertin. Is that correct as well?
No, I have not gone through any literature on that, so I think it's a fake message.
Okay, thank you so much.
Okay. The next question is from Dr. Ayman Sheikh. Dr. Ayman, you can turn on your mic.
Hello again. So my next question is, can a person's genetic makeup influence the chances of him or her contracting the disease or its progression? Or are there any susceptible genes identified yet for COVID-19? Thank you.
There's a lot of research going on in this area, but because it doesn't deal with the urgency of the matter. So I personally have not gone through it, but research has been going on in this area, and probably they'll come up with some things. But as far as the prevention regimen is concerned, for now it has got a very gene makeup has got a very limited role in the prevention and slowdown in the flattening of the COVID-19 curve.
Yeah, okay, thank you.
Okay, thank you, Dr. Ayman. The next question is from Sharyar Hussain. Sharyar, can you please tell us where you're from?
Assalamu alaikum. I'm from
Alaikum
Iqbal Medical College.
Okay.
So my question is, Dr. Amer just said that its size is 400 nanometer and it cannot pass the surgical mask. Is there any valid reference that its size is 400 nanometer?
Yes, I've gone through the literature of both Center for Disease Control and WHO, that its size is more than 400. I'll share, if you want the reference, I can share it with you after the webinar is.
Okay, because I was going through a document and they said that it's just uh, uh, these are rumors that its size is 400 nanometer because its size is just not migrated yet.
No, I have read it personally and I can share the reference.
Okay, thank you.
Okay. So next we have Amal Naeem from FMH. Amal, are you with us? Okay, so Amal has asked that she has asked a question regarding the validity of a thought that usage of simple soaps proves to be more efficient against the virus than hand sanitizers. What is your take on this?
Okay, about hand hygiene, there are two separate recommendations that if your hands are visibly soiled with dirt or anything, then you should opt for washing your hands with soap and water. But if your hands are clean and you just need to make sure that your hands, I mean, you sanitize or wash your hands, then you can opt for sanitizer.
So if they're visibly clean, then you can opt for sanitizer. If they're visibly soiled, then you should opt for soap and water, and make sure that you follow the 7-step method of hand washing.
Okay, next we have Syed Mahmood Abbas from Shifa College of Medicine. Abbas, you can turn on your mic.
Assalamu alaikum.
Walaikum assalam.
All right, the question I have right now is, what is the methodology of the test being used for the testing of COVID-19? And will there be a qualitative PCR method being adopted to go for a further testing for this?
So right now, the method that we are using is a qualitative one. It's not a quantitative one. And the samples that they take is a swab test from upper respiratory tract. And also in severe cases, they are taking samples from lower respiratory tract as well. And then these samples undergo what we call is nucleic acid amplification test. And in nucleic acid amplification test, the test that they are using is called real-time PCR, and it's being done in NIH Islamabad. All of the test kits are imported from outside. We have not yet made our own kit, but they have already got a qualitative PCR test, which is being used to confirm all of these cases.
All right, thank you.
Thank you. The next question is from Hassan Raza from SDMC. Hassan, can you hear us?
Yeah. Assalamu alaikum.
Walaikum assalam.
Okay, I have 2 to 3 questions, and my first question is what we are talking about. Is it vaccine or antiviral drug therapy? If is it vaccine, then how much time is required for a vaccine to be prepared? And if a vaccine is going to be prepared, then how it will be possible to handle the current situation, as we know that the vaccine is only for negative cases.
Okay, so the only country working on vaccines right now is United States of America, and they are trying a lot at the federal level and also in the private sector that they come up with a vaccine. Previously, they were focusing on vaccine, but now I think they are not so sure about it. So now they have shifted their focus towards social distancing and other preventive measures. But usually vaccines for viral infection like these new viruses, they take about 1 to 2 years in the processing, and then they go into trials, and then they get approved. So I don't think so. We shouldn't be expecting a lot from vaccinations as far as Pakistan is concerned, because first it's going to go to United States and maybe some other developed countries. So Pakistan is going to be the last country getting this vaccine. So we shouldn't have lots of expectation for vaccine. So preventive measures, social distancing is the key right now.
Okay, thank you.
Thank you, Hassan. Next we have Ibrahim M. Ansari. Ibrahim, do you have a question? Ibrahim bin Huzaifa from Shifa College of Medicine.
I think Varda is
Yes,
also.
Assalamu alaikum. My question is, does exercise have any benefit for protecting against COVID-19?
No, these are all just rumors that high drinking hot water or exercising is going to make the virus die. These are all just rumors and have got no scientific basis at all.
Oh, okay. Thank you so much.
Okay, thank you. Varda Saeed from University of Lahore also has a question. Varda?
I think I can read the question and I can answer it. So her question is about the survival of virus on non-living surfaces like clothes or furniture. So yeah, the various studies have shown that the virus can stay on these services from 24 hours to up to 6 to 7 days. So yeah, this is why it's highly infective.
Okay. She has another question that the soaps we use aren't any special viral killing chemicals. So are they effective?
Yeah, they are generally, I mean, they're generally efficient in cleaning and shedding off these viruses. Not really killing these viruses, but just making sure that these viruses are swept off.
But it's important that you follow the 7 steps of hand washing to ensure proper cleaning.
Yeah, so washing hands with soap and water or alcohol-based hand sanitizer is recommended by WHO and is part of the prevention regimen for COVID-19.
Okay, the next question is from Shail Faiz from CMC. I read out the question. He has asked that what is the prognosis for people on previously prescribed long-term immunosuppressants and what might be the treatment plan?
Yeah, so they are also part of the high-risk pool and they need to take extra precautions than just normal individuals. So for normal individual, the recommendations are to avoid outdoor activities and to stay at a distance of 1 meter. So for people like these, they need to take extra uh, care in social distancing so they don't get the infection in the first place, because if they were to get this infection, then probably the prognosis is not really good. And the treatment, I'm not sure you're asking about the treatment plan for COVID-19 or for their existing medical conditions. If you can just.
Yeah, if you can tell us, please turn on your mic. Okay, I think he can't turn on the mic. Okay, so we'll move on to the next question. It's from Adila Andaleep, and she has asked that Chuktai Lab is also performing real-time PCR. So is it authentic?
Yes, okay, as far as the Chogtai lab and Shaukat Khanum lab is concerned, uh, federal government and both Punjab government have signed an agreement with them that they are providing NIH kits to Chogtai lab and Shaukat Khanum lab. Uh, so as far as both these labs are concerned, uh, the tests are accurate because the kits are being provided by NIH Islamabad under the contract from both federal and Punjab.
But Dr. May, are they charging more for the same test?
I mean, last night I heard the federal minister talk about these prices. He was not aware that these labs were charging for it because he said we are providing the kits and they are supposed to do these tests for free.
Sir, actually they are charging round about 8 to 9,000 because I checked the website and it was like 7,800 just 2 days ago. So should we be reporting them on this?
I mean, it's already the anchor person already reported that to federal health minister. He said that he'll look up on this matter. So they are already inquiring.
So should we recommend these labs to people when they ask that where should we get tested? Because in Lahore there is no
Everybody.
other
First of
public
all,
institution.
you should do the history taking yourself, okay, without any detailed history taking and making sure that you have defined the case as a suspect case of COVID-19. You shouldn't be doing any recommendations. And if you feel like that the person is uh, fulfilling the criteria, the three criteria that I just mentioned, then you can recommend them to go to designated public health facilities, which in case of Lahore are Services Hospital and Pakistan Kidney and Liver Institute.
Uh, okay, sir. And the last thing I was going to say that please share your slides in different WeFod groups as well because they were very informative and I think they should be shared among general medical students?
Okay, we'll be doing that after the webinar is over, and we'll be sharing the whole session. The whole session is being recorded as well, so whole session will be shared on all social media
Thank you, sir.
platforms.
Okay, there's another question from Kobai from Rawalpindi Medical University. He has asked that can this virus mutate and cause re-pandemic?
Okay, about that, I went through a literature which says that in China already it has mutated into two separate strains. So I mean, viruses, they are supposed to mutate. It's what they do. So, but the current pandemic is not over yet. So we have to deal with the current one and then worry about the mutation and re-pandemic. So if we control uh, if we control and provide the herd immunity for this uh, current strain, I think it will be very less likely that another mutation will be able to cause pandemic, because still our immune systems will be able to counter the slightly mutated form of this virus.
Okay, so I think this is the last question from Saima Batul from Sheikh Zayed Medical College, Rahimir Khan. Saima, you can turn on your mic. Saima, can you hear us? Okay, I think she can't hear us. Are there any other questions? Or if anyone's question was missed out, you can turn on your mic and ask the question. Okay, I think that's all. We don't have any more questions from anybody. Thank you all for joining us today, and thank you, Dr. Omer, for such a wonderful session. The assessment will be, all of you will be given the assessment by tonight, hopefully, and you can fill it, and then we will assess you on based on that assessment, and then certificates will be given to all of those attending in the next few days. Thank you all for joining us today. Dr. May, do you have any last words?
Yeah, my take home message. Yeah, no, Aisha, I'm not infected with coronavirus as yet.
Okay, your take home message.
Yeah, take home message for everybody is social distancing for next 3 weeks, because I'll be sharing the very popular graph that is being shared all over media, that all we need to do is flatten the graph of new cases, and the only thing that we can do about is social distancing. So just stay at your home. The assessments will be through online forms, so it will be like a Google form, and make sure you guys don't resort to any other online resources to answer those questions, and just answer them based upon this webinar. So
It will help us to assess, to evaluate the efficiency of this webinar.
Yeah, we'll be leaving that to individual honesty.
Okay. There's another question from Maryam Murtaza from Sheikh Zayed Medical College, Rahimir Khan. Okay, so she has asked that she's read online that gargling with water and drinking a lot of water eliminates the virus from your pharynx, as it remains in your throat for 4 days before it reaches to your lungs. So is this authentic information?
No, this information is not authentic. I mean, doing that while you have flu helps, because it constricts your blood vessels, and then not a lot of fluid comes out into your airway, so it helps with that. But other than that, for COVID-19, it doesn't help.
Saima has sent us the question that if there is no vaccine and treatment, how will it all end up in your opinion?
Yeah, the whole pandemic will it will be soon, it will be over very soon. But we have to implement the strict social distancing measures as China has already done. USA is doing, some of the European countries are doing. So we have to make sure that that's the only way forward, and we'll be over it very soon.
Inshallah. Inshallah. Okay, Navera, I guess the links will be sent to you on WhatsApp, or we'll send them to the presidents and they can forward to all those who've attended this webinar. Okay, are there any other questions? Okay, a lot of people have questions regarding the assessment. Yes, they'll be sent on your phones through links. We'll share these links with your presidents and they can forward it to all those who've attended this webinar. Okay, Bas, do you have a question?
Yeah, can I speak now?
Yes, you can.
Yeah, firstly, I would like to thank that it was a really wonderful webinar organized by the V4 organization. It was a wonderful experience and I got to know that surgical masks could help. There's a point that I want to highlight over here, that in Islamabad and many other places, we are not being provided by masks and they are being manipulated by many pharmaceutical companies in the areas where we can get masks. So if we can all work together and go on to have a proper provision of masks to everyone, irrespective of either they being in the medical profession or being a general community, I think we all should come up with a collaborative force against the mask being made unavailable for people, because this is a need right now, a dire need for the people right now.
Okay, Abbas, thank you so much for bringing this thing up. I totally agree with you on this. And it's very unfortunate with our nation that whenever we are in a situation like this, the first thing we do is pile up the stock and try to earn some good money on it, and then maybe do a umrah later on with that money. But but the uh, but the thing is that we were in contact with few of our sponsors who are producers of masks, but they are also out of their stock because most they have either exported this stock to outside countries, because previously it was needed in China and Iran. So they have also said that we are out of stock. With some companies, the problem is that they are really out of stock and the production lines in China, because the masks originally they are produced in China and then they are imported here in Pakistan. So production lines were disturbed, and with some other companies is the problem is the stockpiling, and government is also working on it. But right now it's more of a global phenomena as well. Things are really in short supply. But I agree, if we can, at least raise our voices, that's the least that we can do.
Also, I think that it's important to spread this message that those who do not need the masks should not hoard up on them. So if we spread awareness regarding this, that if you do not need the mask, so you don't have to keep it in stock. So maybe it will be available for those people who actually need it, like healthcare workers, professionals, or those who are actually sick. So I think it's important to spread that message as well.
And I was listening to the health minister last night, and we should be hopeful that the situation will get better in next 1 week or 2 weeks, because they are importing lots of masks and other protective equipment now. Thank you so much.
Okay, Bas, does this clear out your query?
And yeah, thank you so much.
Thank you. All right. I think we're done with questions. Thank you all for being here with us today. It was a pleasure. Okay. Allah Hafiz to everyone. Goodbye. Allah Hafiz. And thank you, Dr. Mayor, once again. Okay.